Assalamualaikum and good morning. We are from Group 2 and today we will present our seminar paper titled Citizen-Centered Service Delivery in Malaysia, a new public management perspective. My name is Hasnur Rizwan and with me are my group's members, Ms. Shashila Saad, Mr. Hakim Buang, and last but not least, Ms. Siti Noatika. In this presentation, we will explain the background of our topics, the problem statement, what the literature says, our methodology and findings from our review, and finally, our recommendations and conclusions. Over the past few years, public administration has been changing quite a lot. Around the world, governments are under pressure to respond to higher expectations of citizens, to keep up with rapid digital development, and to make administrative processes clearer and easier to understand. Today, people are more aware of their rights as users of public services. They expect better service quality, and many of them compare government services with what they get from the private sector, which is usually faster, more user-friendly, and more responsive. Because of this, traditional bureaucracy, which is very hierarchical, rigid, and procedure-based, is increasingly seen as not suitable for current needs. In response, many countries have turned to new public management, or NPM, which promotes a customer-oriented approach, more autonomy for managers, clear performance indicators, and culture of continuous innovation in the public sector. At the same time, the idea of citizen-centered or people-centered service delivery has become more important. This approach suggests that services should be designed based on the real needs and experiences of the people, not just according to the internal routines or old system. Compared to traditional model, a people-centered approach pays more attention to making service accessible, understanding what users really need, and improving their overall experience. It also sees the public not just as passive users, but as partners who can help improve public services. In Malaysia, we can see effort to modernize public service delivery, especially through digital platforms. For example, MySejahtera changed how people interact with health services and government information during the pandemic. Online services at JPJ, JPN, and the My Government portal have also made many daily affairs easier for citizens. Policy documents such as My Digital Economy Blueprint and initiative under MAMPU show a clear direction to a more user-friendly and integrated service delivery. However, as we will show later, these efforts still face several challenges and move towards a truly citizen-centered system is not complete. Now, I will pass the presentation to Shashila, who will explain the problem statement and the main points from the literature.
Thank you, Hasno. I will start with the problem statement of our seminar paper. Even though Malaysia has taken clear steps to modernize public administrations and expand digital services, public service delivery still does not fully reflect a citizen-centered approach. In practice, people experience are not consistent. Some still face slow process, repeated paperwork, and service flows that do not feel connected. In many agencies, internal procedures are still given more priority than user needs. Office continue to follow long-established hierarchical structure and rigid routines. This makes it difficult for agencies to respond quickly or adapt to what citizens really needs. Another issue is that many government departments use digital systems that do not work well together. Citizens often have to give the same information many times or move between a different platform just to complete related tasks. There are also gaps in digital access. Urban communities usually have better internets and more digital skills, while many people in rural areas, low income household and older age group still face barriers. Finally, feedback systems are not working as well as they should. Even though online channels exist, many citizens feel their complaints or ideas do not lead to real change, which can reduce trust in public institutions. When we look at all these challenges together, we can see that Malaysia's intentions to provide citizen-centered services does not always match the daily experience of users. Next, I will briefly highlight what the literature says about our topic. Many authors agree that people today no longer accept public service that are slow, disconnected, or too complicated. Merger at 2021 described how governments are shifting away from traditional bureaucracy towards more flexible and service-focused systems. Albro and Hood 2020 explained that new public managements or NPM encourage public agencies to adopt some private sector practice and to see citizens as a valued customer rather than passive recipients. In other words, NPM provides the framework for understanding citizen-centered service delivery by focusing on service quality, performance, and responsiveness. The literature also emphasized the role of digital tools. Digital platforms are often seen as key instruments to improve service delivery, but technology alone does not automatically solve problems. What matters is whether digital tools actually reduce the difficulties that people face when dealing with governments. OECD 2023 notes that trust in public institutions is higher when digital services are simple to navigate, join up across agencies, and able to respond quickly to citizen needs. Lips and Carter 2022 argue that digital platforms are most effective when they are designed based on the way users actually navigate services rather than on complex internal procedures. In Southeast Asia, Kim and Sequin 2021 highlight persistent gaps in infrastructure, uneven digital literacy, and weak coordination between agencies as key obstacles to digital governance. Malaysia faced similar challenges. Okay, finally, author likes Bannister and Connolly 2020 and O'Flynn and Blackman 2023 reminds us that reform will not succeed if internal culture and engagement practice do not change. Staff need the mindset and autonomy to respond to citizens, and citizens need to see that their feedback is taken seriously. Now, I will pass to Siti Nur Atika, who will explain our methodology and key findings.
Thank you, Sheila. I will start with the methodology used in this seminar paper. Our study used a qualitative and conceptual approach. We did not collect primary data such as survey or interview. Instead, we rely on secondary sources including academic journal articles, policy documents, and institutional reports. Most of the material were published between 2020 and 2005, and they focus on the citizen-centered service delivery, which means NPM and the Malaysian public sector. We selected the literature using three basic criteria. First, it must relate to citizen-centered service delivery. Second, it must be connected to the NPM perspective. And third, it must be relevant to the Malaysian context. After reading, we use a simple thematic approach to group the information under themes such as digital transformation, bureaucratic culture, system interoperability, and citizen feedback. This method allows us to describe more clearly how citizen-centered service delivery has developed in Malaysia and which factors influence it. I will now summarize the main findings of our paper. First, Malaysia has made real progress in digital adoption and public sector reform. The rapid growth of digital public services, especially during and after COVID-19, show that Malaysia can implement large-scale digital solution. MySejahtera is one example that had millions of users access information, communicate with authorities, and manage basic health-related tasks more easily. The increasing use of online services in agencies such as JPJ and JPN also point to a gradual move towards more citizen-oriented services structure. These developments are in line with NPM principles that stress better service quality, customer orientation, and innovation. At the same time, several gaps and weaknesses remain. There are still clear inequalities in digital access. Rural community, lower income household, and old citizens face problems such as weak internet coverage, limited access to devices, and low digital skills. These barriers reduce their ability to benefit from digital public services and can widen existing socio-economic gaps. Bureaucratic culture also remains strong. Many agencies still rely on rigid procedure, strict hierarchy, and manual verification process. This often causes delay repeated tasks and inconsistent service quality between offices. Our findings also show that systems across departments are fragmented. There are many digital platforms, but they often operate separately. Citizens may need to enter the same information many times or move between several sites to complete one task. Finally, although digital platforms provide more channels for engagement, feedback mechanisms are still not fully utilized. Many citizens feel that their complaints and suggestions do not lead to visible change, which weaken trust and reduce willingness to give feedback in the future. Next, Hakim will present the recommendation and conclusion of our paper.
Thank you, Siti Noatika. Now I will present the recommendation from our seminar paper. We group our recommendations into 5 main areas. First, Malaysia needs to improve digital infrastructure and make access more inclusive. This includes expanding broadband coverage, improving network reliability, and offering more digital literacy programs, especially for rural communities, low-income groups, and older citizens. This can help reduce the digital divide. Second, there must be cultural change in the public sector. New technologies will not be effective if internal routines remain rigid. Public servants should be trained and supported to be more flexibility, responsive, and citizen-oriented, in line with NPM ideas. Third, the government should more toward better integration and interoperability of digital system. A more whole of government digital setup which share data standards and systems that can connect with one another would reduce repeated data entry and make service smoother for citizens. Fourth, feedback, engagement, and cooperation mechanism need to be strengthened. It is not enough to simply collect complaints or survey responses. Citizens must be able to see how their views are used. This means having clearer steps for collecting and reviewing feedback, regular reports on the main issue raised, and public updates on changes made based on that input. When people see that their input is taken seriously and leads to real changes, trust in public services is likely to grow. Finally, Malaysia should treat public sector reform in a holistic and long-term way. Digital projects should not stand alone. They should be connected to leadership development, human resource planning, and citizen engagement. When technology, people, and process are aligned in one framework, reforms are more likely to be sustainable and consistent with NPM principles such as efficiency, accountability, and service quality. To conclude, citizen-centered service delivery has become an important benchmark for public sector performance, especially as citizens become more digitally aware and have higher expectations. Our paper finds that Malaysia has made clear progress in digitalization and modernization, especially through platforms like MySejahtera and various online services. However, Malaysia has not yet fully reached a citizen-centered services model. Ongoing issues such as rigid bureaucracy, fragmented system, digital inequality, and weak feedback system still affect how people experience government services. Overall, we argue that technology alone is not enough. Real improvement depends on changes in organizational culture, better coordination between agencies, and stronger citizen engagement. Finally, we suggest that public administration should be guided by citizen-centered principle so that public services are seen as useful, fair, and trustworthy in an increasingly digital society. Thank you for your attention. We now welcome any question or comment.